trial right is a tricky thing. It sounds great in theory. There's usually a period of time that's pretty stressful for folks. And I've seen people do this plan that you're doing, and they get that heart attack the month before they were going to switch, and they're in the hospital for 6 weeks, and they didn't switch because what happens is...
I've been doing a lot of research. Right now, I'm pretty healthy. What I'm leaning to do is do an Advantage plan and take advantage of my trial rights and try to find a decent Advantage plan with a give back. And what I want to do is I'll probably get some indemnity plans, maybe a supplement plan for critical illness, maybe a cancer and heart attack. But I'm looking at the best ones, the best Advantage plans with the decent copays and give backs is ones that don't have drug coverage. Am I able to take one of them and then get on a Medicare Plan D at that time so I don't get penalized? Or what options do I have for medical or for drug coverage if I take that route?
There are give back plans that do have the drug plan attached to them. They don't just have to be the MA onlys for veterans, like the ones you were mentioning there. And so there are some, and it depends on where you live. I mean, and Pennsylvania, to my knowledge, does have a few of them actually available in the area.
Michael, you're saying most of the better or the higher give back Part B reduction plans don't have drug coverage. Is that what you're saying?
Correct. Like I found one for $148, but it doesn't have drug coverage, but it has much better dental, lower copays. I was hoping I could do like a Plan D or, Medicare Plan D to supplement that. Yeah,
that would be great, wouldn't it? That is not the case. You cannot have both a Medicare Advantage plan like that and a drug plan. It's just you're just not going to be able to do it. So what ends up happening is you would end up having to pay out of pocket for all of your medications if you didn't have a drug plan, and you'd be penalized when you do choose a Medicare Advantage plan that has drug coverage included down the road. So you can't, unfortunately, you can't have the best of both worlds. Most of those plans, they're designed for people who have either FEHB, which is Federal Employee Health Benefits, or VA benefit access. And so if they go that direction, they have creditable drug coverage that they can maintain through one of those systems. Then they get one of these, what's called an MA only plan. That's what you're describing. And, they are feature rich. You are correct.
And that's why they have the names like the Eagle and Patriot and
they're kind of like supposed to sound patriotic or militaristic.
They're designed for those kind of things specifically. Yeah.
So your plan is to do a Medicare Advantage for a while, then trial right into a sup plan. Is that right?
Yep.
Okay.
Yep. Into an end plan.
Yeah. Let me give you like a little bit of like feedback, things you may not know. First off, you do have that right. Trial right is a tricky thing. It sounds great in theory. To be able to do that, and I understand like, I want to save some premium dollars for a little bit. So on that so if your plan is to do that, whenever you go guaranteed issue, is what that's called. And the other thing I was going to mention, when it comes to a trial right, again, it sounds good in theory, and you can save some money, right? There's usually a period of time that's pretty stressful for folks because what happens is you have to be disenrolled from your Advantage plan. You make application for your supplement plan. Then you wait for a couple of weeks to get what's called a disenrollment, a voluntary disenrollment letter from the Advantage plan carrier. And then that letter then goes to the insurance carrier. And then the new supplement carrier says, okay, we see that you actually qualify, because insurance companies don't like this type of business. They don't like people doing exactly what you're doing. So they add hoops and they try to make it hard for you to do it. And if you think about it, from your perspective, you're assuming, hey, I'm going to be healthy this entire time. Okay. Well, what happens is we see people do this. They go on an Advantage plan. They retire. 6 months in, they get a cancer diagnosis. And so they think, oh, hey, I'll trial right into a supplement plan and all my bills will be taken care of. The insurance company knows that, and so they have to plan for that. And so they don't like accepting that business. So number one, they say brokers don't tell. They're like, brokers don't, and we're a broker. We're not going to pay you. We're not going to incentivize you. We're not going to. You're cut out of this deal, basically. Like, because we don't want you guys doing that with all of your customers. And so you end up kind of in no man's land for a little bit, where you're wondering if you have insurance while you're waiting for your old plan to cancel, to get this disenrollment letter that then gets sent to the supplement plan carrier, and your supplement plan has pended, and it's like not being accepted. They're like, hey, you got to prove to us you actually get this. And then we provide that, and then it can go through. And all I'm saying is I want you to make sure that the juice is worth the squeeze on that. Okay. It sounds like a great idea, and there's people doing it. But at the end of the day, is it worth a couple $1,000s to go through all of that? I don't know. Because what's going to end up happening is if something does happen in your health, you're probably on a plan with a $5,000 max. And so then you not only set yourself up for all this heartache, and I've seen people do this plan that you're doing, and they get that heart attack the month before they were going to switch, and they're in the hospital for 6 weeks. And they didn't switch, and their family didn't know they needed to switch. And we're trying to do stuff, at 11:59 p.m. on the last day of the month. I'm not saying it doesn't work. I'm just saying it's a great theoretical plan. In practice, is it worth it? Yeah. I don't know.
What I'll do a lot is there's a 6-month window from when your partner starts.
Listen to this. This is good advice.
So starting September 1st, you'll have a 6-month window to have open enrollment, to change to whatever you want, without any medical questions during that period of time.
So get a Medicare supplement without any medical underwriting.
So 1, 2, 3, 4. You have through the end of February of 2027 to do that. And what's convenient for you actually with your birth date is you got the first quarter, January through March of OE, open enrollment, where you can switch to a standalone prescription drug plan from your Advantage plan with no worrying about where am I going to find an election code to make this happen. So you can save the premiums for that 6 months in that guaranteed acceptance window and immediately flip March 1st to that plan in that you were talking about.
And there's none of these extra hoops I was describing.
Guaranteed to switch immediately, and then you've got your drug plan, you've got your supplement, and you've saved the $100 a month you would have been spending, plus that give back of $210 a month that you're looking at saving there for that 6 months, still $1,200. That's right. Let's do the math on that. So $1,200 you'd still be saving to that period of time, and that gets you a much easier window of making that. And it's also not that longer. So what I don't like about doing with trial rights specifically is when you say, well, I got any time this year to make that change. And what Josh was saying was that heart attack that comes out of nowhere can really come out of nowhere. We can't plan getting sick. Right. That stuff's going to happen. And so, but if you set a date and be like, okay, so I'm doing good, I'm not having a lot of issues, but February is when I want to make this change to March. It's not just, I'll get around to it when I get close to the end of that date. Having a shorter time window and setting it in stone is going to make it a lot easier to ensure that something doesn't just randomly happen. Obviously, you can change sooner in that 6 month if something does happen, but it's a much less risky window of time to make that change.